Now, um, said cortisol is a multitasker. It influences nearly every part of the body, such as metabolism, energy control. When the body is stressed or when the body is undergoing certain things like certain stress like pain, fear, hunger, injury, threats, the cortisol is going to help the body to make and save energy when needed. It's going to increase blood sugar by telling the liver to make glucose. Not only it does not only depend on glucose, it also break down other foods nutrient sources such as fat, protein for energy. Then it helps your body cope when you haven't eaten in a while. That's why when you wake up in the morning, you still have you have energy to start your day. So it has also help in metabolism. And then it's also help the cardio. It's also has function it does in the cardiovascular system, and that is when there is stress in the system, it's going to tell the heart to pump blood faster, and it's also going to increase the blood pressure during stress. And what does this does? It helps it helps the heart to pump blood faster to the essential organs such as the brain and the muscle, and the side effect is going to cause hypertension because there's going to be an increase of blood pressure. And then the immune system, the cortisol it also has a function it does in the immune system, and that is why doctors prescribe it in certain situations such as arthritis and asthma. Reason why it helps in reducing inflammation. Going to help in reducing inflammation. In such situation like injury, when there's an injury in the body, there's going to be redness, there's going to be swollen, there's going to be pain and hotness. And this is because when there's a threat in the body, there's going to be excessive perfusion. That is there's going to be blood is going to those areas, and it's going to the blood vessel in those areas is going to be permeable to release blood and to release blood cells such as the white blood cells in to fight those threats in the body, and this is going to cause the redness around that area, and there's going to be release of fluid and chemicals causing swollen in that area, and then hotness due to increased activity, and then there's going to be pain due to nerve sensitivity to those chemical that is being pushed in those areas, and that is the physical manifestation of stress, of inflammation in the body. And what this cortisol is going to do is going to control this inflammation. By how? It's going to stop the enzymes that makes these chemicals, that makes chemicals. Now, when there's injury, certain chemicals are being released to those areas, such as prostaglandin and other enzymes, which is responsible for causing this redness, which is responsible in causing those pain. And what this cortisol is going to do is going to stop those enzyme that leads to release of this chemical that causes those stuffs. And not only that, it's going to tell the body what fights infection in the body, such as the T cells and the macrophages. It's going to tell them to please stop. When it notices that this their fights, what they are doing is now leading to damage of the tissues of the organ, it's going to tell them to calm down. And not only that, it's going to strengthen the walls of this tissue to prevent what they call to prevent damage. So that is what cortisol does to reduce inflammation. It's going to stop the enzyme that causes the release of chemicals. So in the case when there is injury such as prostaglandin, it's going to quench it. And it's going to stop the release of white blood cells such as the T cell and the macrophage that causes this inflammation. It's going to tell them to please calm down when this their activity is now causing damage of the tissue or the organ they are working on. And not only that, it's also going to cause vasoconstriction. Reason why is when there's infection or when there's a threat in the body, there's going to be vasodilation to enable the white blood cell to move out of these capillaries, to move out of these capillaries. Okay. I mentioned when we are treating anatomy that the venous, this is where there's an escape of these white blood cells into the system when there's an infection. So what this cortisol is going to do is going to narrow the blood vessels. It's going to narrow the blood vessels, and which is going to prevent leaking, like leaking of these chemicals and white blood cells to this area. So that's what cortisol actually does to prevent inflammation, that is the immune system, from overreacting. So please note, the blood vessels where these white blood cells such as the T cell and the macrophage is going to be released when there is an inflammation, when there is a threat, is the venous wall. That is the venous. Like after the capillaries, that is the venous, and then the vein. So that's the venous is where it's going to be released. We mentioned, if you haven't watched our anatomy series, please go and watch the venous and the vein. And you may mention the functions of the vein. It helps the blood or back the carriage of blood back to the heart, and it's also a part where the white blood cell is being released in case there's an infection in the system. And then this cortisol also acts on the brain, and that is what affects our mood, our focus, and our memory. And this cortisol is going to help our brain to stay focused and motivated. And that is why excesses of this is going to cause anxiety, poor sleeping habits, and also depression. Now, the general signs of this Cushing's syndrome. How do you recognize when someone is having this Cushing's syndrome? The first one is weight gain, which I've explained how what is going to cause this weight gain, because there's going to be excessive release of glucose, blood sugar, and which is going to cause weight gain, especially in the trunk, and that is central obesity. And then fatigue and weakness. There's going to be fatigue and weakness, such as because the muscle is going to be weak. Because I mentioned that the glucose is also stored in the muscle, and then there's going to be breakdown of glucose, and which is going to lead to fatigue and weakness. There's going to be slow wound healing. We all know that protein is also converted into glucose, and we know that when protein is converted, there's going to be less protein, and we know that protein is the bodybuilding bodybuilding food source, and which is going to lead to slow wound healing, and then increased susceptibility to infection due to immune suppression. That is why it's very, very important. I'm going to mention this in carefully as we are riding on. There's going to be increased infection rates. If this person is prone to infection because the immune is already suppressed. And then physical characteristics, there's going to be moon face. The person is going to be rounded and puffy. There's going to be moon face, and there's going to be buffalo hump due to fat deposition on the upper back and neck. There's going to be buffalo hump, and then central obesity with thin leg due to muscle wasting in the arms and leg. You know that the glucose in the muscle is also going to be breaking down. And then there's going to be purple or reddish striae, which is stretch mark. There's going to be stretch mark on the abdomen, the arms, and the thighs. And then there's going to be bruises due to the poor wound healing. When these patients sustain injury, it's very difficult for that injury to heal. And then there's going to be facial flushing or acne. And then there's going to be excessive hair growth, especially in the area in women.